So in this video, we'll talk about scaphoid. First of all, the scaphoid bone consists of three regions. We have the proximal, and this is come in proximity or touching the radius bone, and then we have the waist, and then we have the distal bone. Why is this important? Because of the management. So any fracture in the proximal pole, the answer is always surgery for fixation surgery, whether the bone is displaced or non-displaced. Any fracture in the proximal bone, always the answer will be fixation surgery. However, if the fracture is in the waist or distal bone, this will depend. If the fractured bone is displaced, it has moved away, then the answer is fixation surgery. If the fracture in the waist or the distal bone is undisplaced, then the answer is cast for 6 weeks. Okay, so we have few scenarios. So the patient comes in, and then we see a fracture on X-ray. If we see a fracture on X-ray, it depends on the region. As I said, proximal is always fixation surgery. Waist and distal bone depends. Displaced, then fixation surgery. Undisplaced, then cast for 6 weeks. That's the first scenario. And the second scenario is the patient comes, but there is no fracture on X-ray. However, there is so much pain on the anatomical snuff box. In this case, what we need to do is to put the patient for 2 weeks on something called Futura splint, which is basically a plastic bandage that will immobilize the wrist. And this is only given for 2 weeks. After 2 weeks, the patient has to come for another clinical review, examination, and then we will take another X-ray. So that's second scenario. The third scenario, if the patient after 2 weeks comes to me and he's asymptomatic and we did an X-ray and there is no fracture, in that case, discharge. Nothing to be done, that's fine, everything is fine. And the fourth scenario is after 2 weeks, the patient is still symptomatic, however, there is no fracture shown on X-ray. In this case, we need to order MRI. Why? Because the patient is symptomatic, but I cannot still see the fracture on X-ray. And I need MRI to see where the fracture is, because this will determine the management. Again, if it's proximal, then we need to fix it surgically. If it's distal or in the waist, then it depends, displaced or undisplaced. Displaced, then surgery. Undisplaced, then it's cast for 6 weeks.